Do you have what it takes to be great? Of course you do. Greatness means different things to different people and looks different depending upon your profession. But at its core, those who are great share some common traits. You would not have endured the rigors of becoming a surgeon if you weren't passionate about making a positive difference in the lives of others. But it is also likely that you have other passions that make you who you are, that actually help you to be a better surgeon. That is certainly the case for ACS President J. David Richardson.
I'm very passionate about my family, and I think it could be rightly said that I'm pathologically close to my family. I'm very passionate about Kentucky. I'm a native Kentuckian. Two of the activities that we're noted for in Kentucky are basketball, which I'm very passionate about, and particularly horse racing.
In life and in surgery, there are good days and bad. But like Dr. Richardson, you embrace the opportunities you have been given. Appreciating and seizing those opportunities is what gratitude is all about.
That opportunity to impact someone's life who had cancer, who was injured, to me was an extraordinary opportunity that I thought was a blessing, and I take that very seriously and certainly have tried to do that in my entire career.
It took tenacity to become a surgeon, and it takes tenacity to practice in today's complex and constantly changing environment.
The biggest challenge I see in medical practice and surgical practice is the industrialization of medicine, or the commodization of medicine, if you wanted to use that phrase.
There is another challenge that Dr. Richardson thinks that the practice of surgery is facing.
I think everyone is concerned about patient safety, and that absolutely must be paramount in all that we do. But at some point in time, the bird has to leave the nest, if you allow that analogy, and surgeons have to begin to function on their own. And we likely need a better transition from training into practice now, and I think that's been somewhat of a challenge for the profession to do.
The quality of surgical training is also dependent on mentoring in the larger sense.
The greatest joy I've had in my professional career, other than the direct satisfaction of seeing patients do well, is to be able to mentor young women and men in a variety of areas.
Another challenge, Dr. Richardson says, is surgeon shortages, particularly in rural America. And he believes the college has an important role to play in addressing it.
There are desperate problems today in rural America for the provision of surgical care, and I would submit that those are likely to increase over time, and that it's absolutely crucial that we have an advocacy program that makes people aware of that and tries to address some of those needs.
Dr. Richardson believes surgeons must also be tenacious in their pursuit of quality.
In the area of quality, which is certainly, I would submit, not simply a pillar of the college, but perhaps a foundation point of the college since its formation 100 years ago, it's absolutely essential that our fellows own quality. And by that I mean quality has to become personal. They have to embrace it and make it theirs.
Another of your trusted partners, Dr. Richardson sincerely believes, and you likely agree, is the college.
For me, being a part of surgical organizations, of which the college is the most important to me, has been one of the most rewarding experiences in my life. Just discussing the commonality of problems with your peers, the commonality of solutions, the fact that we're not in this alone in terms of the problems we face, both clinical and non-clinical, provides us enormous opportunity in networking and in fellowship. Those are the intangible benefits to me, are perhaps as great as the tangible benefits of quality programs, educational programs, and all the other member services that the college provides.
So, look around you. You are surrounded by passionate, grateful, tenacious, and trusting surgeons. So, yes, you are great. And your patients and the college are reminded of that each and every day.